My name is Denise Gruden. I am the Medicare Sales Executive with Western Health Advantage. And today we have a guest speaker. That would be Laura Newman. She is with Mom's Meals, and she is the Director of Strategic Partnerships. Laura is going to take us through today's presentation and show you the benefits of Mom's Meals for Western Health Advantage members. Laura, would you like to take it away?
Certainly, I am ready. Am I okay to share my screen?
Yes, I'll go ahead and request to share, and I will give you the control.
Well, this might make you hungry, this presentation, but hey, yes, everybody, my name is Laura Newman. I am a Director of Strategic Partnerships with Mom's Meals. Very excited to be here with you today. And I'm going to lead you through a little bit of understanding of who Mom's Meals is and what the benefit looks like for 2022, and eager to answer any questions you may have while we're together. So our mission at Mom's Meals is improving life through better nutrition at home. Mom's Meals is a national nutrition solutions company. We deliver to all 50 states, including Puerto Rico. We've been doing this for about 22 years now. We are headquartered in Ankeny, Iowa, just outside of Des Moines. We ship out last year, it was almost 60 million meals delivered. And so we have a nationwide footprint. We have 2 USDA inspected kitchens, one's in Iowa, one in Ohio, and we are building a 3rd kitchen in Oklahoma City. And then we have different distribution centers and cross docks around the country so that we've got operations everywhere to serve members. There is a mom behind Mom's Meals. Our name comes from Barb Anderson, who's pictured down below in the green sweater with her own mother. She is one of the co-founders of the company, and 20 years ago, she was taking care of her aging mother and mother-in-law who both lived alone, and they were dealing with multiple chronic conditions. But simultaneously, she had 2 sons who were off at college who were both athletes. And nutritionally, she felt she could do better by her family. So she started to prepare and deliver large portions of family favorites to them on the weekends. Her son's friends said, "How can we get more of your Mom's Meals?" So 20 years later, we're delivering meals to every single state in the country, and we're really proud of that heritage. So we are in healthcare serving a number of different types of customers out there. Certainly our wonderful partners at Western Health Advantage, and that does include other hospitals and health systems. We serve other government programs, Medicaid members out there, and then certainly there are folks that pay privately for Mom's Meals. And you're seeing a picture down there of our executive chef. So it wouldn't surprise you that we're very passionate about food at Mom's Meals. And one of those people is certainly the executive chef, John Benedict. He's been with us for 15 years and studied at the Culinary Institute of America. And he is really passionate about preparing delicious home delivered meals for our members. We update our menus twice a year. So there are flavors of the season. There's a spring summer menu and a fall winter menu, and then seasonal produce to keep people delighted. So he works closely with our team of registered dietitians to make sure our food is not only really enjoyable, but also meets all of the special needs of the condition-specific menus that we support. So rolling right over to that, let's cover our menus. Our food's really wonderful. So we have a general wellness menu. That's our most popular menu that meets the dietary guidelines for Americans. We have several menus for people with special dietary needs. So there's lower sodium. That's appropriate for anyone who might have high blood pressure. We have a heart-friendly menu that's low in sodium, also low in fat and saturated fat if someone has coronary artery disease or high cholesterol. Our diabetes-friendly menu is going to be a maximum level of carbohydrates in the meal. And then that one is also low sodium. We have renal-friendly, that's for someone who's on dialysis or if they have stage 4 or 5 kidney disease, but don't yet need dialysis, it will protect your kidney health. Cancer support is higher in calories and protein. We do have a full gluten-free menu for those with celiac or just prefer a gluten-free pattern of eating. We do have vegetarian, and we also have pureed. So if someone has lost teeth or has difficulty with swallowing, maybe due to a stroke or Alzheimer's or cancer, that's the menu that gets selected for them. I've had the wonderful opportunity of eating mom's meals and trying the different menu types, but I've got to tell you that, the pureed line, there are 16 different menus in that category alone. And for instance, one of the pureed meals I've tasted is chicken enchilada with refried beans and cinnamon apples. The taste, the color, the smooth texture, it is so delicious. And it just so happens that flavor and freshness are two of our highest customer satisfaction areas. So now a little bit more about our partnership with Western Health Advantage. This is just a quick overview of the meal program that was designed. So this is for post-discharge support. And members who have had an inpatient hospital, skilled nursing facility, or rehabilitation discharge are eligible for post-discharge meals. The quantity of meals that you would receive after your discharge is a total of 56 meals. So it's designed to be like 2 meals a day for 4 weeks. Or another way you can look at this is you're going to receive 4 weekly orders of 14 meals. You can eat them at a cadence that makes sense for you, but we just wanted to let you know kind of what that quantity and design looks like. You are able to actually eligible to utilize the benefit up to 4 times per year. So that means that if you did have more than one hospital stay or skilled nursing stay, you would still be eligible to get mom's meals more than once per year, which is really wonderful benefit. So the first cooler that contains 14 meals is shipped to your home, and it's delivered within 3 business days of us receiving the referral. So we work very fast at Mom's Meals to fulfill all orders on time and in full. And then those second, third, and fourth coolers of 14 meals will be shipped the following week so that you can just take them one grouping at a time. We do deliver to your home address, and those post-discharge meals come to you via third-party carriers. So that means UPS, FedEx, Golden State, a number of carriers are our partners here at Mom's Meals, and they work hard to get the meals to your doorstep on time. If you as the member have questions about your benefit, your best bet is to call Western Health Advantage at the number you see there, 888-563-2250. I want to talk a little bit now about the member experience. What goes on when Mom's Meals arrives at your doorstep? So this is just a few images of our cooler when it arrives. It's a standard cardboard box insulated with a foam liner. Here you see the entrees stacked together with the side items that go with that meal. And our meals are all refrigerated. But we do put frozen gel packs placed on top during shipping to keep the food cool while it's in transit. When you open the box, there are handles to make it easier to pick up the box or pull it to where you need it to be. And all entrees are in their respective trays. They're sealed and they're labeled. The side items that go with the meals could be juice boxes, muffins, crackers, whole fruit, applesauce, etc. Just depends on the meal type that was ordered for you. And then this is a picture of when you take those meal trays out of the box and you put them in your refrigerator. They are compact and easy to store. And these meals can be in your refrigerator for up to 2 weeks and still be fresh. They can also be frozen for up to 3 months. So if you were feeling like you wanted to tuck a couple away for later, you can safely do that. Of course, Mom's Meals are made with high quality ingredients. All of our kitchens are USDA inspected kitchens. And really these are packaged again to stay in your refrigerator for up to 14 days, but heating the meals is super easy. So 3 ways to do it. You can break the seal or puncture the seal and put it in the microwave for 2 to 3 minutes. The instructions are on the label, so you know exactly how long to heat the meal that way. Or these can actually actually be put in a conventional oven as well. They could be heated that way. But what if you only have a cooktop? You can use that too. You would take the food out of the tray, put it into a skillet, add a little bit of water and heat on low. So lots of ways to heat the meals. But I want to assure you that the meals are already fully cooked. So if for some reason someone did not heat the meals, they would still be able to consume them safely. But obviously, your experience is going to be better and the aromas are going to be better and cheese is going to be melting and all that good stuff. So I just want to let you know that we're often asking our members for feedback. We want to know how they feel about Mom's Meals, and we know that 76% prefer the taste of our refrigerated meals compared to frozen meals they've ever tried before. And we know that a large percentage of people eat healthier and more regularly with Mom's Meals. So, it takes a village here at Mom's Meals. We've got lots of teams behind the scenes working hard for our partners and their members. And one of those teams is certainly our customer service team. So we don't want folks that call us to ever have to go through a phone tree or wait on the line. It's all live answer. So if for some reason you didn't receive your meals after your hospital stay, or you had any questions or feedback for us, you would call us directly. All of that information is located inside of your meal cooler. So there's going to be a number of inserts inside that give you a rundown of the different meals you've received, how to get a hold of Mom's Meals if you have questions. So we definitely give you probably more than enough information. We are all live answer. We're bilingual too. So we're Spanish speaking and English speaking customer service representatives. And then we do support 160 languages with our language line. So we're prepared to communicate with anyone. We do operate in Central Time. We're 7 a.m. to 6 p.m. Central. And I just want to stress that we do have a really strong culture of caring, and we want to feel connected to the people that we're feeding. Our team is very compassionate and empathetic, and we want to listen to you. These are trained professionals that not only provide great service, but they're listening to you because, we're listening for health notifications. So, if you ever if a member sounded like they were in need in some other way, we're going to communicate that back to Western Health Advantage because we're partners, and that's the best way to serve you all the way around. So it really does stem. This whole partnership has been designed to help people have better nutrition and even more so post-discharge. There's a lot of consequences to poor nutrition, and if you're coming out of the hospital, it might take you longer to heal and get your strength back. And this is where home delivered meals becomes a solution that meets so many needs. We know that malnourished patients are 2 times as likely to be readmitted to the hospital, and we want to help you avoid that. We know that readmissions go down by 39% when home delivered meals are provided post-discharge. And from a quality perspective, this is really important for you, the member, the hospital, and certainly Western Health Advantage, because collectively we all want to reduce readmissions and length of stay. So I just wanted to grab a few testimonials I'm aware of that people have shared with us as it relates to Mom's Meals, and it's things like, thank you for the meals. It's so nice to have a hot meal that's easy to prepare when I'm recovering. The food is excellent, the portions are good, and the food is a lifesaver. It's been a blessing. This one is my favorite because it makes me laugh, where the gentleman said, I'm enjoying the meals and my wife is enjoying not cooking. And before this meals program, I was eating toast and cereal because it was easy, but now I'm eating a variety of fruits and vegetables. So we're really here to provide you with the nutrition that you need. And when events happen unexpectedly, we can't always shop and plan ahead for our recovery. And it's nice to not have to come home to empty cupboards. Or if you're the one that normally does all of the cooking, it can be really taxing on your spouse to make sure you're getting the proper nutrition. And a lot of people will go through the drive-through or look for easier alternatives, which most often are not healthy. So these testimonials are definitely a testament to that. So there is a little piece of marketing that was developed for members to consume, and this is something that you may get emailed to you or might get personally handed to you, or maybe it's in an educational area. But it's just a quick two-pager that runs down how it works for members at Western Health Advantage. So it's really easy. Meals are available to members post-discharge, and a referral form is getting completed on your behalf. You don't have to do anything to get mom's meals, and you don't call us to initiate meals. All of this important work is happening in the background for you. We just want you to recuperate and get better. And I do want to let you know that once we've received the referral from Western Health Advantage and we start processing your order, you will get a welcome call. So you're going to get an outreach from our very friendly customer care department, letting you know that your post-discharge meals are being processed for you, and you're going to get, for instance, maybe the diabetes friendly meal if that was chosen, and they let you know how it's coming, maybe UPS and what day it's going to arrive, just so that you can be ready for this. So I think that that's a really nice experience for you, so that you know what's coming. And I think this is my last slide, but I just wanted to share with you that if you're really curious about mom's meals, we're flattered by that. You can certainly visit our website at momsmeals.com. If you'd like to get a glimpse of some of our menus, you can certainly do that. And there's a link there for exploring our menus. If you go into our website, you would actually click on individuals and caregivers, and that would be the easiest route to explore menus. And you can look at everything that we've got out there. And then our website is full of great articles for members to consume. So things like the vital role of nutrition after a hospital discharge, and something past the salt or not, and new year, new you, prioritizing nutrition to prevent chronic conditions. So we're really here to make sure that you as the member feel confident in the great tasting food that's here to help you. And I was just wondering, I know we are about 17 minutes in, but I was curious if anybody had any questions for me.
Actually, I don't see any questions. That was a wonderful presentation. Thank you so much. Let's see, do we have any questions for Laura? Now's the time. Okay, so are people able to order meals just on their own from Mom's Meals if they're outside of being in the hospital?
Yeah, so that's a great question. So yes, so the answer to that is that yes, we do serve members who want to pay out of pocket for meals. And this is very commonplace. We find that folks that have had a chance to taste our meals in a post-discharge program like this say, hey, that was so convenient. They were so delicious. I would like to get more meals for convenience and just to take the load off of cooking of me for a while. So yes, you would just visit us at momsmeals.com, and you would be able to access our website this way and place an order through us online. Certainly, there's also a way to place order via telephone. And if you feel more comfortable talking to us and having us place the order with you over the phone, we're happy to do that as well. And you have access to all the 9 condition-specific menu types, so that's available to anybody. Meals are typically about, if you're private paying, it looks like meals are going to cost about $7.99 each. And then $8.99 for the meals that are either gluten-free, pureed, or renal friendly. $1 more for those meals. They're a little extra special for us to produce. So, but that's basically the price for each.
Wow, that's a very reasonable price range. Making me think here. So thank you. No, this all looks so wonderful. We appreciate you as a partner so much. And I know that our members will if they haven't experienced it, and do if they have. So thank you so much, Laura. I don't believe we have any other questions, but if we get any, we'll make sure that we contact you. And again, folks, you can always contact us at 888-563-8255. 2250. It's the member service number. It's also on the back of your ID card. And we hope that today's presentation was helpful in understanding your benefits with Western Health Advantage through Mom's Meals. And I think what we're going to do is wait just a moment and see if there's any more questions. I also want to let everyone know that this presentation has been recorded today. This presentation, along with our previous webinars, will be posted on our website in case there's something you want to go back and re-listen to or you missed one. You're more than welcome to do so. We will be having another live series probably later in the year, but up to this point we have recorded all of these sessions so that they're available to everyone anytime you need to listen to it.
I do actually see
thank
a question that we didn't answer previously, if it's okay to answer it now.
Of course, of course. I must have missed it. I apologize.
Oh, so the question
go
was,
right ahead.
do the calories show on the package? Yes, so you're actually going to get all the nutritionals on the sealed meal, just like you would with any other FDA approved package meal. And then there is going to be an insert in the cooler that is a listing of all the nutritionals. I will share that when I started working at Mom's Meals, I wanted my parents to try it because I wanted to know what they thought. And so I shipped meals to my mom and dad, and they had fun taking that insert out of the package and, you know, making notes next to the meal and noting what they loved. And so yes, lots of detail there on each meal.
Great. Well, I will definitely be ordering some meals after this. That omelet looks delicious. Well, all of it did, really. Okay. Well, I want to thank everyone again for their time. Thank you again, Laura, for joining us. We appreciate you.
Thank you. Thanks for the opportunity.
Sure. I'm going to bid you all a good day, and please reach out to any one of us if you have any questions about the benefits or how to place orders. Thank you.